Hey, this is Different Careers with Kate Nudd. We're going to continue chapter 8, and I don't know how many videos will be in this one, but let's get started. Now remember, we are doing massage therapy principles and practice, going over, all the ins and out of what is massage. So if you, end up watching this whole series, it will help you be educated and know the ins and outs for an intellectual level, to know the do's and don'ts of being a client, maybe even a licensed massage therapist in New York State if you're thinking of moving to New York State. So let's continue on with joint mobilizations and stretches.
Swedish gymnastics, part of the Western system, is discussed in this section. The primary movements used in Swedish gymnastics are stretches and joint mobilizations. During the massage, the therapist takes special care to address the client's needs with massage strokes, applying pressure on tender areas. To further assist the client in restoration of healthy tissue and pain-free movements, the therapist may use another method of the Swedish system called Swedish gymnastics. These movements can be applied before, during, or after massage. Stretching and joint mobilizations are the most commonly used movements in Swedish gymnastics. Joint mobilizations involve moving a joint. Stretching involves muscles being drawn out to their fullest length. The movements used in Swedish gymnastics can be classified into two primary categories: passive movements and active movements. Passive movements are applied by the therapist while the client remains relaxed or passive. Active movements involve the therapist describing or demonstrating the movement while the client actively performs them. Active movements have two variations: active assisted movements and active resisted movements. Active assisted movements are performed by the client while the therapist assists. Active resisted movements involve the therapist applying gentle resistance while the client is actively engaged in movement. Use caution if any abnormality is present, such as a surgical replacement, pins or wires, and any conditions where movement must be limited or avoided, such as edema, inflammation, osteoporosis, rheumatoid or osteoarthritis, dislocations, scoliosis, spondylolisthesis, spondylosis, or hypermobility. The lengthening and sweeping motions should not induce pain. It is helpful for the client to relax and inhale at the beginning of the movement and exhale during the stretch or mobilization. Take the joint through 3 range of motion exercises or a muscle through 3 stretch repetitions. Hold the stretched muscle for up to 5 seconds, release, and hold again for the second repetition. Repeat for the third and final repetition. The techniques presented in the following section are passive movements. Most movements are performed 3 times and repeated on both sides of the body. Practice these with an instructor or an experienced therapist.
Now again, I currently still have my license to practice massage therapy in New York State in the United States of America. However, I am no longer actively seeing clients or massaging clients because of negativity and sexual harassment that happened in the workplace. So this was in my private practice. This happened when I worked for a spa. So again, clients need to do their part to be draped properly unless you are fully clothed. So in this video, perfect example, going over stretches, the person is basically wearing exercise close so it's easier to maneuver the client. That is the best way to perform stretches. However, in massage therapy school, I did learn how to perform stretches with the client helping holding the sheet in a proper way for modesty. So, yeah, uh, it can be done so you can do a stretch and regular skin to skin with lotion or oil or cream, whichever their preference is, the client's preference, or, essential oils, depending on what the client wants. But you mix the essential oils with the cream, the lotion, or the oil. So, again, it's what does the client want, and that's why it's important for licensed massage therapists to talk to their client before each massage and be like, what do you want to get out of the massage you receive? So then you can get the very best massage you possibly can receive and enjoy and truly relax. And communicating with your licensed massage therapist. So let's continue on.
Swedish gymnastics for the neck include neck circles, neck lateral flexion with rotation, and neck forward flexion. Neck circles. Place one hand on the client's forehead, rocking the head back and forth while your other hand intermittently pulls the tissue in the lamina groove on the opposite side up and toward the therapist. Neck lateral flexion. With one hand, pull the client's head toward the near shoulder while your hand stabilizes the client's far shoulder. Neck lateral flexion with rotation. With one hand, pull the client's rotated head toward the near shoulder while your other hand stabilizes the client's far shoulder. Neck forward flexion. With one or both hands, hold the client's shoulders while your crisscrossed forearms support the client's head. Lift the head toward the chest.
Okay, now a disclaimer, in massage therapy school, they did show me how to do some assisted stretches. They didn't show me how to do resisted stretches where you're pulling the client's limb and they're resisting and trying to pull the opposite direction. They did show how to do some traction, and that's basically grab the ankles in a comfortable way and pull and grab each arm and pull, and then neck traction a little bit with a towel or a pillowcase. So traction did feel good when it was done in a comfortable way. And other massage therapists, sometimes they pulled way too hard, squeezed my ankles way too much, and I didn't know how to communicate with them to tell them to keep the traction but release like the squeeze, or because it was like they were grabbing me in a way where it's like it was causing pain. So continuing on, we did neck.
Gymnastics used for the wrist and hand are flip wrist, interlace fingers during movements, metacarpal scissors, circumduct fingers, and pull fingers. Flip wrist. Use your fingers below the client's wrist to flip it up and down while your thumbs stabilize the top of the wrist. Interlace fingers during movements. Interlace your fingers with the client's fingers while moving the wrist into flexion, extension, abduction, and adduction as your other hand stabilizes above the wrist. Metacarpal scissors. While holding the client's metacarpals, alternately move them up and down. Circumduct fingers. Support the client's forearm with one hand while the other circumducts each finger and thumb with mild traction. Pull fingers. Support the client's hand while the other hand pulls each of the client's fingers and thumb from its base.
Okay, continuing on.
The basic movements for the shoulder and elbow are pull arm down side, pull abducted arm, push adducted arm, pull arm overhead, big shoulder circles, and little shoulder circles. Pull arm down side. While standing tableside, grasp the client's wrist and pull firmly down toward the toes. Pull abducted arm. While standing several feet away from the table side, grasp the client's wrist and pull the arm straight out to the side. Push adducted arm. Push the client's shoulder and arm horizontally across the table. Pull arm overhead. While standing at the head of the table, grasp the client's wrist and pull. Big shoulder circles. Beginning with the client's arm at his or her side, pull arm up over the head, then down to side by bending the elbow while maintaining traction during the movement. Little shoulder circles. Grasp above and below the client's shoulder, moving it in a circular direction quickly.
Now, in that video, they were showing some traction, and for me, when it came to massage techniques, I did one thing at a time. That means one stroke, one massage technique at a time, even if it was only for 30 seconds or something. So I let traction be traction. I didn't try to move any joints and do traction at the same time. But there was a movement I learned when I was taking an essential oil class where you jostle your client. You literally pick up the ankles, they're in the face cradle, and you kind of like rock them in a vertical motion on the table. And the purpose is to get the lymphatic fluid moving, but I wasn't doing traction. So that seems like you could accidentally hurt someone if you're trying to do traction and arm movements at the same time, because you're trying to do two things at once on an individual, which doesn't seem like it would really work. So let's continue on.
The Swedish gymnastics movement for the back and the spine uses a lengthening and twisting motion on the supine lying client and is called spinal twist. There are 4 variations. Spinal twist 1. Lift the far shoulder while anchoring the far hip. Spinal twist 2. With the client's near leg bent and the foot placed on the lateral side of the far knee, push the bent knee away from you while pulling the far shoulder toward you. Spinal twist 3. Anchor the near shoulder while you push the bent near knee away from you. Spinal twist 4. Anchor the far shoulder while you pull the bent far knee toward you and down.
Now, for some reason, I don't know why, but that's one of the stretching techniques in massage therapy school they never went over with me. So I guess they didn't think it was important, or they did everything in a more broad and vague way where here's your basic technique, figure the rest out on your own as you go. Which, if I were a teacher, I would have included how to thoroughly stretch the whole body with the myology class, where it's the study of muscles, and they didn't do that. They just like talked about, this is where this muscle attachment goes, this is where this nerve goes, and it's like, isn't the whole point of being a massage therapist being able to thoroughly stretch every single muscle in the body and know how to do that on your client? Why wasn't that a part of the class? So it was like, well, you got some of the knowledge, not all of the knowledge. And it's like, they left it up to each student after they graduate. If you want to know this, you got to learn it yourself. So it was kind of rather ridiculous that you're paying teachers to teach you and they didn't want to do a thorough, good job. But it is what it is. So, maybe it should have been a 4-year degree to become a licensed massage therapist in New York State instead of like 1,000 hours in a year or in 6 months or a year and a half or whatever. But that's how the school I ended up going to operated their massage school, is barely have any days off, maybe 1 day a week. You are embracing learning how to be a massage therapist, studying for a whole year. Then you graduate and you wait 3 months to see if you pass the boards or not. So it is what it is. But didn't learn spine stretching techniques in massage therapy school.
Swedish gymnastics applied to the hip and knee are leg pull, leg rock, hip clock stretch, hip circles, groin stretch, hip rotations, heel to hip, and hip hyperextension. Leg pull. While standing at the foot of the table, grasp the client's ankle and pull firmly. Leg rock. While standing tableside, place your hands above and below the client's knee and rock back and forth. Hip clock stretch. Flex the client's hip and knee while supporting both the knee and heel. Imagining the client's leg as the hour hand of a clock, push and stretch the hip in a 10 o'clock, 12 o'clock, and 2 o'clock position. Hip circles. Move the flexed hip and knee in a circular direction. Reverse direction. Groin stretch. Place the flexed near leg on the table, with the foot by the straight far knee. Stretch by gently pushing the near knee down toward the floor. Hip rotations. Picking up the near leg above and below the knee, rotate the hip by pushing the leg in, to the side, and out several times. Heel to hip. Flex the near knee, bringing the heel toward the hip. Hip hyperextension. Pick up and hyperextend the near hip while the knee is flexed. The lifting hand should be placed above the near knee.
So again, be gentle with stretching people. You don't want to over stretch people, because then you can make them their muscles feel achy and sore the next day, or possibly for the whole week. So it's like, clients do need to be like, okay, let me know when you feel the stretch, because a little bit is really good enough. Because if they're not stretching all the time, then again, if you don't normally reach down, stretch, and touch your toes, then like every once in a while, if you go out of your way to reach down and touch your toes, you're going to stretch all of the muscles really in your thighs and your legs on one side, and it could be achy and sore for a while. So it's like the point is to relax the muscles, but you want people to feel relaxed the next day, enjoy the massage. So be careful what you do. So again, sometimes I felt like clients didn't share enough details with me, how they felt after the massage. So, and they didn't seem to communicate when I hit the beginning of the stretch. And so I was like, did I overstretch them? Did I do what I was supposed to do? My intention was just to go to the beginning of the stretch where they feel the stretch a little bit. So you're relaxing that muscle, and then it stays relaxed. So that was my intention. So one last video.
Gymnastics movements for ankles and feet are plantar flex ankle, dorsiflex ankle, leg rotations, metatarsal scissors, circumduct toes, and pull toes. Dorsiflex and plantar flex ankle. For dorsiflexion, push the ball of the foot toward the knee. For plantar flexion, push down on the top of the foot. Leg rotations. Rotate the hip by circumducting the ball of the foot as you hold the client's heel as if a handle. Reverse direction. Metatarsal scissors. While holding the client's metatarsals, move them up and down. Circumduct toes. Support the client's foot with one hand while the other hand circumducts each toe with mild traction. Pull toes. With one hand, hold the client's foot while your other hand pulls each of the client's toes from their base. Circumduction and pulling toes can be done simultaneously.
Now again, traction. I did not do on the toes. I did not do that really on the ankles. Unless people came in and they were complaining about my feet hurt, my ankles hurt. I just did a routine massage on their feet. Unless someone specifically said, I want my toes massaged, I didn't go out of my way to like massage each toe. I focused on the bottom of the foot because that's where that allowed for other time for other focus areas, because most people complained about their back, the neck, the shoulders. So I focused the upper chest, the pectoralis or pec region, because then it freed up the shoulder more, or deltoids or whatever. That was the main thing everyone was complaining about: shoulder problems, neck problems, and sometimes the arm. So it's like sometimes I did incorporate stretches into the massage because I was like, okay, let's massage it, let's stretch it, let's get this area worked thoroughly. So after going through all these videos, if I were to be an active licensed massage therapist again, I would have a introductory massage where you have to get a clothed table massage first. So that means you would get compression through your clothes. You could have assisted stretching through with the clothes on. And then there's Thumper Mini Pro where you could vibrate the muscles through the clothes. That's what I would do. And then again, a part of that would be, okay, we're going to undrape a certain area to practice draping, so you know how sheet draping works when you come back again as a returning client. And then they get Swedish deep tissue massage, which is thoroughly working out the knots and trying to get to the deeper layers of the muscles. And then you have like a essential oil technique that can help with lymphatic drainage or boost the immune system. And then you have stone massage, right? Or focus on stretching, or, like you could just do stretching for the whole massage again. But again, if I were to do this again, if someone wants stretches, okay, let's do stretches with your clothes on only. And people would probably need to take like 15 minutes to practice getting on and off the table properly and making sure, like, okay, this is how we're going to do draping next time. If you want your clothes off ever, and again, it's just one area of the body undraped at a time, you need to be able to be reasonably still. If you move, you need to tell your licensed massage therapist, me, that you have moved and may need to be redraped or retucked. And then I would want to get paid for every second, every minute, and every hour of the massage, and for all of the massage supplies, and for the time to do laundry and soap notes of that client. So I would want to get paid for the whole entire time, and that means the work that I did for them when they weren't in the room. So that's how I would do things differently. And if people are going to make up the prices of tons of different things, well, it's like, well, to make it, probably to even get by, you really need $1 million or $5 or $15 million a year to be able to pay for your own apartment, maintain a car insurance, and be able to have at least 1 week of a full paid vacation for the full year, and that includes your basic necessities of life of food, clothes, shelter, car insurance, vehicle, maintenance on your car and all your equipment, and health insurance. So I never got paid a legitimate wage to cover all the basic necessities of life. So I hope that everyone else is doing better in their careers where it's covering at least all the basic necessities of life. I never got paid a legitimate wage. So in my own practice and in spas, basically I got paid for some of the minutes in the hour. I only got paid for some of the minutes that I actually worked. I didn't get paid for every single minute and hour that I worked for the client, because sometimes you may even need to do research for a client. If they have a problem, you need to look up things in a book, right? Well, that takes time to do that. So why can't you get paid to do that research, to review those stretches, so you make sure that you're doing the proper stretches on each client too, and kind of like being able to like plan your massage better for that client. So I wasn't able to necessarily do all that, so I was like thinking on the go, trying to do the best I could in the moment, because again, clients didn't value me getting a legitimate wage, so I could do an even better job on them. So it is what it is. I am happy that I'm not doing this anymore. And again, if things switched over, like a lot of massage therapists that I saw, they didn't do a very thorough job on me and like really relax my muscles. It was more about receiving safe, loving touch, and the massages became less and less effective for me for some reason. So if a robot is more effective and thorough than a real living being massaging me, then yeah, I probably will opt out to be like, if someone ever creates and develops a robot that can give you a better massage than a living being, I'm probably going to take the robot version, because I want to be pampered. I want all my muscles to be thoroughly relaxed. So hopefully society will change where there are robot thorough massage therapists, because that sounds amazing to actually have a robot be thorough and effective, because all the other massage therapists I saw, they weren't really effective. I literally told them I have muscle tension by my spine from my neck all the way down to my sacrum area, and they refused to work by the spine thoroughly to try to alleviate that muscle tension. So it was like, well, why did you ask me what was wrong if you weren't going to do something about it? Don't even bother asking, you know? And that's also when I asked for a deep tissue massage or my knots to be thoroughly worked out. They just ignored the problems where I actually felt the muscle tension. So I was very annoyed and irritated, and I always felt like I was doing a better job than all these other massage therapists. So I literally got burnt out of the industry. I got burnt out because other massage therapists didn't respect me, and clients didn't really respect me. So goodbye. And again, on all my channels, positivity and negativity are allowed to be here, because you need to be able to vent. You need to express your emotions. You need to get it off your chest, so to speak, because that's how you release it in a positive way, where you're how do we put it? You're not bringing any physical harm to yourself or anyone. You're letting people know, I didn't like being treated this way. It's not okay. You know, if I didn't say anything, it'd basically be letting everyone know who was a client, who was a boss, who was a massage therapist that worked on me. Oh, it's okay that you didn't do a good job. You can keep doing a bad job on all your other clients, on all the other massage therapists you trade with. You can do a terrible job on everyone. It's okay that you believe you're a great massage therapist, even though you're not, because you didn't do a good job on me. You know, you really want me to be that way? Isn't that more negativity? Isn't that causing more harm to individuals? Or it's letting them go for years and years and years and letting them think, oh yeah, I did an amazing job on Kate Nudd when I traded with her for massages. No, you didn't do a good job. None of you did a good job. So, goodbye. I don't want to work on living beings. If I practice massage techniques, I'd probably want to work on a robot. Because it sounds more fun actually practicing on a robot, and then it's like, you know what the robot's gonna do, and then the robot does a thorough job on you, and it's nice and relaxing and effective. That's how I picture these robots being that massage you. So I look forward to it whenever it comes into existence. Robots massaging a real living being and doing a thorough and excellent job that is effective, way more effective than any of the massages or stretches that people did on me. So, again, positivity and negativity are allowed to be here. That is my solution to getting out of having to receive massages from massage therapists or licensed massage therapists that don't do a thorough, excellent, good job. Someone needs to invent robots that replace the massage therapists that don't want to do an excellent job for every single client, including a massage therapist they trade with or work on. So again, I try to come up with solutions. When will these solutions be implemented? I don't know. Maybe technology has to increase and the technology for knowledge has to increase. But if it exists, or if it's gonna exist, I'm excited about the future because, massages are great. They feel wonderful, but you want it done the right way. And I don't want to pay people tons of money for not doing a good job, right? So, like, for me, realistically, when I went to see other massage therapists, it's like, well, if you alleviated 1% of the muscles for a whole hour of working on me, then I really should have given them $1 for an hour. I'm sorry, the massage didn't last. You only deserve $1. So you wasted energy because you didn't do your job right. Okay? So I don't know what was going wrong, but it's like they definitely did not know how to at least alleviate my muscle tension, help my spine problems. Everyone was like, oh, it's genetics. It's genetics. You inherited these diseases and these health problems. It's like I was on a pretty much plant-based diet. Your plants are supposed to heal you, and people are telling you to eat flesh meat, to eat a living being that became dead, and they think they know true health. I don't think so. I don't know why they kept telling me, oh, go ahead, eat a living being that became dead. It will give you all your nutrients. I don't think so. So again, it's like, apparently either we were speaking different languages or something was going on, because like, who in their right mind would want to eat a living being that became dead to get all their nutrition? That doesn't make any logical sense. So anyways, a bunch of clients said I did a good job, but they never asked me to come back to the workplace. My boss never addressed the sexual harassment issues in the workplace. So it's like, I did my own private practice already. Clients didn't respect me in my own private practice to keep coming back more thoroughly, and then to make sure they're always draped in the safe manner. So it's like, at the end of the day, I'm glad to be done with the massage industry. I am glad that I will pick a different career. I don't know what that is yet. We shall see. Again, positivity and negativity are allowed to be on this channel, in all my channels, and for everyone. So that way, you can do something about the problems. You can speak up. So if you're a client, the massage therapist is doing something wrong, speak up. If it didn't register in their brain for some reason that they're doing something wrong, please repeat yourself so it registers. Because there were some clients that were like, I want you to go super deep. And then they got mad at me. They're like, you went too hard. Well, then why did you tell me at the very beginning of the massage that you wanted super deep pressure and make me think that I had to lower the table, and that because I'm thinner and a littler person, a decent, sized littler person, that I wouldn't be able to deliver the pressure you want? Okay, so then they complained that I hurt them, and then they never came back. So it's like, again, you need communication with the licensed massage therapists. So again, that's why my solution is get rid of the living beings, stop massaging the negative people that don't want to communicate with you, who don't want to speak properly, that don't actually really want to pay you what you're worth, and switch over to robots only. Eventually, when knowledge increases so much that robots will give you a better massage than a living being. And some people declared to me they don't want robots. I'll be replaced. Well, if you didn't want to be replaced, then maybe you should do a good, thorough, effective job. You know? So I'm okay being replaced because I would like to replace all the bad massage therapists that massaged me and have a different career entirely that doesn't involve massaging any living being, that doesn't value a thorough, effective massage. So I'm rooting for robots to do a better massage someday than any living massage therapist, so that I can get real health and real pampering and love myself in a safe, loving way. So I hope you enjoyed this video. If you have any massage therapy questions, feel free to put that in the comment section below. If you're a client looking for a massage therapist, what types of massages do you normally get? What types of massage techniques do you normally like your licensed massage therapist to use on you if you currently receive massages? And if you're a licensed massage therapist, do you actually do a good job for all of your clients, including the other licensed massage therapists that you massage? Feel free to comment in the comment section below. Until next time.